The equipment check is a vital part of resuscitation readiness. All equipment for a complete resuscitation must be immediately accessible and fully operational. Simply noting which items are present does not help you determine which items are missing. Check your supplies in the order in which you will need them, starting with what is needed for initial steps and ending with equipment needed for complex resuscitation. Use the equipment checklist from the instructor manual. Can you warm and dry the newborn? Preheat the warmer and make sure there are towels or blankets for drying the newborn. Can you clear the airway if necessary? Check for 3 things in this category: a bulb syringe, a suction catheter attached to the wall suction set at continuous and adjusted to 80 to 100 millimeters mercury pressure, and the meconium aspirator in case tracheal suctioning is required. Can you auscultate the newborn's heart rate and breath sounds? Make sure the stethoscope is present and working. Next, check to make sure you can administer oxygen if necessary. Turn on the oxygen to 5 to 10 liters per minute. Adjust the oxygen blender to the initial concentration desired and make sure the tubing is connected to the oxygen source. When you think oxygen, think pulse oximetry. Have the probe ready to attach to the newborn first, then connect it to the oximeter. Can you ventilate the newborn? Check your positive pressure ventilation device to make sure it's functioning correctly. The self-inflating bag is tested by sealing it against the palm of your hand. Does the bag deliver a breath? And does the pop-off valve work? Do you have a term and preterm size mask? So far, you can warm, clear the airway if necessary, dry the newborn, auscultate, oxygenate, and ventilate. Next, check the intubation equipment. Check the laryngoscope for a bright light and secure bulb. ET tube sizes 2.5, 3.0, 3.5, and 4.0 should be available along with stylets. Make sure you have an end-tidal CO2 detector ready for use. Can you medicate the newborn? Make sure medications and supplies to place an emergency umbilical venous catheter are accessible in your crash cart or medication box. Your equipment check is complete. You can warm and dry, clear the airway 3 ways, auscultate, oxygenate, ventilate, intubate, and medicate. Your equipment check is complete and you're ready to receive the newborn.